Ramadan is the holiest month in the Islamic calendar. It involves abstaining from eating, drinking, smoking, and having intimacy with your partner from dawn to dusk in the hopes that it will lead to a greater taqwa or consciousness of Allah. Muslims were commanded to fast during Ramadan more than 1400 years ago. The ancient Greeks recommended fasting to heal the body, and today many scientists advocate fasting for its multifold benefits. Here are some of the positive impacts fasting can have on your health and well-being. Curbs appetite and helps in weight loss. Observing Ramadan and fasting gives your lifestyle and digestive system a positive U-turn. As your body gets used to eating less, your digestive system gets a chance to rest and your stomach gradually shrinks in size. This reduces your appetite, and the result can last longer than many trendy diets. In another article in the Washington Post Tehran Diet, doctors are reported to be using Ramadan to help overweight people achieve their goals. The common practice for most Muslims is to gorge on sweets and fatty foods as soon as the sun sets, but doctors would encourage a healthy evening meal consisting of soup, fresh bread, dates and other fresh fruits, goat cheese and proteins. These foods come without the sweet temptations and sauces, and thus have a slimming effect on our body. Experts say dates are one of the healthiest fruits with high level of potassium, magnesium and vitamin Bs to give us the desired energy boosts. Lowers blood sugar and regulates bad cholesterol. With long hours of food deprivation, our blood sugar tends to go down. However, people with diabetes should consult their doctors before fasting for long periods, but those with high blood sugar but no diabetes will benefit from the process. Ramadan enjoy a positive effect on their lipid profile, which means a reduction of cholesterol in the blood. Low cholesterol increases cardiovascular health, which will reduce the risk of heart disease such as strokes or heart attacks. If Muslims follow a healthy diet even after Ramadan, they should have no problem keeping this lowered cholesterol level. Many people aim to lose some weight by fasting. However, a recent study found that fasting also affects the lipid profile. This results in blood cholesterol, which can keep heart attacks, strokes, and other diseases at bay. A month-long detox. Besides spiritual cleansing, fasting allows the body detoxify the digestive system as we refrain from drinking and eating throughout the day. When the body starts eating into fat reserves to create energy, it will also burn away any harmful toxins that may be present in the fat deposits. This returns the body in a blank state, supporting a consistently healthy lifestyle. Boosted mood and mental clarity. Fasting can be a method of supercharging the brain, increasing growth and developing of new brain cells, in turn sharpening responses to information in the world around us. Studies also show that fasting can also make the brain more resilient to stress, more adaptable to change, and can improve the mood, memory, and even learning capacity. According to a study by American scientists, the mental focus achieved during Ramadan increased the level of the brain-derived neurotrophic factor, which causes the body to produce more brain cells, thus improving brain function. It promotes clarity of mind and reduces stress, especially when fasting leads to a distinct reduction in the amount of the hormone cortisol produced by the adrenal gland. Besides, body begins to adjust to its eating, drinking pattern as higher levels of endorphins appear in the blood, hence making us more alert and happier, thus adding a boost to our general well-being. Absorbs more nutrients. Fasting throughout the day can make our metabolism more efficient, thanks to the combination of fasting and eating late night, which produces an increase in hormone called endopronectin, thus allowing our muscles to absorb more nutrients. Various areas of the body will then be able to make use of nutrients needed to function effectively. Keeps a tab on potential health risk. While fasting may reap surprisingly great benefits, medical experts cautions diabetes endangers. There are 1.6 million Muslims in the world and 148 million have diabetes, and the number is growing at a faster pace than in non-Muslims, says Osama Hamdi, Medical Director of the Obesity Clinical Program, Director of the Inpatient Program at the Joslin Diabetes Center, Harvard Medical School. In presenting his research on Ramadan fasting and diabetes at an American Association of Clinical Endocrinologists conferences in Austin recently, he says the effects of fasting during Ramadan, which requires no food or fluid from the sun-up to sundown, can include dehydration, hypoglycemia during fasting hours, and hypoglycemia after the big meal at the end of the day. Some of the large end-of-the-day meals, which may be eaten quickly because of hunger, can be as high as 1500 calories and usually include sugary desserts specific to Ramadan, he adds. He suggests that patients do a trial fast 3 consecutive days before Ramadan to help them and their doctor adjust insulin dosage, including fasting. Though fasting may cause complications such as heartburn, irritability, dehydration, and a decline in concentration levels, its benefits outweighs the negatives. You should have a balanced diet with the right proportion of carbs, fat, and protein, Dr. Maruf advises. Evidently, fasting during Ramadan, if done in the right way, will not only lead us to deeper spiritual awareness but will also pave the way for a healthier lifestyle.